AHEC is a national nonprofit. Our main mission is to develop the healthcare workforce through education. So we provide programs for current professionals, we provide programming for high school students, we provide programming for college students, which includes AHEC Scholars, a 2-year internship program.
I think one of the things that appealed the most to me with the AHEC program was the opportunity to be able to explore any health profession.
The thing I love about the AHEC program is it gets students to deal with real world problems.
It is a 2-year internship program consisting of 2 parts. The first part is a set of modules that you'll learn about topics such as cultural competency, behavioral health integration, and interprofessional education. And the other part of the program is the experiential learning opportunities. So essentially, this is where we send students out into the community to partner with our community partners, really get hands-on experience with the community, engaging in public education about health topics, really doing things that make an impact on the general public as a whole.
During the didactic portion of the program, I feel like I learned some really valuable skills that will benefit me as a future health professional, specifically social determinants of health, cross-cultural communication and cultural competency, especially patient engagement and behavioral health integration. And I think these skills can apply to all health professionals. Every health professional will have to incorporate those skills into their job. I actually was able to participate in a number of hands-on experiential learning projects. I volunteered at the Commission on Economic Opportunity right here in Troy, New York, and I also was able to participate in presenting health professions information to a local middle school, and I also worked on a opioid education and prevention presentation. As I got into the workload, I realized how valuable the information was, and I was able to apply it to my other classes or just to the experience that I was getting from the hands-on experience, and then knowing that I could apply it down the road.
We're training future healthcare professionals to create a broader perspective of their future patient population. For example, when you're in school, you can learn all you want about theoretical patient cases and the definitions of diseases, diagnoses, and whatnot. But until you really get out into the field and interact with people, learn about their stories, the struggles that they go through, and how you can engage in solutions, that is what Scholars does for the general public.
I think it helps the community because they get a different perspective. So while our students are in there, they're looking at the social determinants of health. They're looking at the things in the world other than, are you getting your medication? Are you seeing your doctor? That can impact health. And they provide a perspective to the providers sometimes that they may not be thinking about. It helps the community because the individuals get to see students, and long term, it's going to be more help because it's really promoting our students going out and working in the field where there's greatest need.
One of the things that students always tell me is, I never would have learned about this in class.
I would certainly recommend the AHEC Scholar Program to other students. The formal college curriculum really gives you your credentials to do your job. And I feel like the AHEC Scholar Program teaches you how to do your job better, how to be a better health professional, and how to better serve the diverse populations that you'll be working with.